be people who self-direct themselves, FMS providers, or states who want to participate in research? How do they take that initiative and jump in?
Yeah, I can take this one. It's a great question. I think it's important to note that our research study, that we just talked about how COVID has impacted, people with disabilities who receive, who self-direct those services. That research study would not have happened without people with disabilities on our advisory committee who told us this is what needs to be studied right now. This is what we have questions about, this is what we have concerns about, and this is what we need you guys to study. So I think it's really important that as researchers we're listening to, to the disability communities. And in terms of, how they can get involved, this, as I previously mentioned, the way we found our participants was through organizations. I already mentioned the national organizations, but state organizations like Access Living in Chicago, like the Disability Policy Consortium and Stravros Center for Independent Living in Massachusetts, organizations like the Disability Rights Education and Defense Fund in California, and Topeka Independent Living Resource Center in Kansas, and ADAPT in El Paso, Texas. Those were fundamental, those were crucial organizations in finding people who would want to share their story and who would be helpful in terms of understanding what is happening during COVID at this time. So I think it's really important that those stakeholders, people who self-direct, whether you're an FMS provider, you reach out to organizations like the Community Living Policy Center and the other organizations across the country that are doing this research to not only say, this is what needs to be researched because this is what we're seeing on the ground, but also, connecting us with the people who can be a part of our research to ensure that the voices of the disability community are at the forefront of our research.
No, I think that's great. And Mark, Jennifer, or Allison, any comments to add on how different stakeholders can get involved in research?
I think it was really well put. I mean, I think, I think if it's a relatively small community, right, of people that are working in this area, and I think just kind of reaching out directly. I mean, some of the best collaborations happen that way, if you sort of get a random email. So any of us, and I imagine others in this field, just kind of taking the first step from different stakeholders. I mean, which is, again, just sort of underscoring, some of the comments were just nice.
Yeah. And Allison and Jennifer, I'm curious if you could share, what are some of the biggest challenges that you face in studying self-direction? What are some of those hurdles that have to be crossed?
I think just real quickly, and I know we're short on time, but I think three things that there's certainly more, but three that comes to mind. I mean, one is it's just such a complicated system. There's so much variation across states and different models of self-direction, different types of services, different types of consumers. And so to the extent that one wants to do a more kind of like what we talked about at the outset, a natural experiment, or kind of a more quantitative study, it's hard to winnow down all that complexity, and really define a discrete, manageable question that you can really get empirical traction on, and try to distinguish kind of correlation from causation. So I think it's just it takes a long time to really understand that complexity well enough to really tackle it in a rigorous way that accounts for all the complexity. Secondly, there's just very little data publicly available. I mean, Medicaid doesn't really track outcomes systematically for home and community-based services. Neither do states. It's kind of a little bit scattershot and fragmented, and so that's all the more reason to build innovative partnerships with various stakeholders like ASD, to obtain the data necessary to shine light on these really important questions about self-direction. And then also, I think we still have pretty limited tools, for measuring the outcomes we really care about. I think there's consensus that we need to look at outcomes both from sort of a quantitative, more objective, quote-unquote, objective outcomes like whether somebody's employed, whether they get COVID tested, emergency room visits. On the other hand, I think there's also consensus that we need to as well integrate more person-centered measures that have to do with subjective well-being and satisfaction. And that's, of course, required in many ways under the HCBS settings rule, which emphasizes choice and control. So I think blending those two types of measures is really critical, but it still really hasn't happened yet in a really systematic way. And so I think that's kind of the next frontier in research, and being able to use a really robust, multifaceted set of outcome measures to analyze outcomes in self-direction, will be a really big step forward as we move towards that.
I'll just add one comment related to questions that I'm seeing in the chat in terms of difficulties in studying self-direction. I think another difficulty that Allison and I have faced in our research is, even when we find good candidates for inflection points to study, such as the introduction of EVV, which I see several of you have asked about, sometimes the timing doesn't work out right with the data. So this is something that Allison and I have definitely considered in our research, and unfortunately, in a lot of states, the introduction of EVV coincided with other changes in the state. So from a data perspective, it would be very difficult, if not impossible, to parse out what's the effect of EVV versus what's the effect of other changes that happened at the same time.
Right. Those are great points. I'm curious if Mark, Michael, Joseph, or Sandy, do you have anything to chime in on challenges or biggest challenges you face in studying self-direction?
This is Joe. I just would echo, like, the first thing that came to my mind is the availability of data, and especially, trying to work with Medicaid claims data. It's hard to identify, people that are self-directing within that. There were some improvements, and we're hoping to take a look at that, but that's been a big challenge for us. And yeah, I agree. The way around that is thinking more of partnering with the fiscal management organizations and the managed care organizations, which have a lot of data. So I agree with what Allison said.
Yeah, no, that's a great point. Mark, what challenges have you faced in the projects that you've done?
Well, I totally agree with what has already been said, but I can tell you some of the challenges, particularly around the inventory. Sometimes even if you get somebody at the state office to talk with you, your data is only as good as that person's knowledge of the program is, and we've gotten better at triangulating, finding, making sure that the information that we receive from the state is in alignment with what we might read on the waiver application for that particular program. Sometimes we'll, reach out to the FMS providers in that state to be sure that the numbers are all sort of within the realm of possibility. So, not only finding the appropriate person to answer your questions, but also making sure that there are other ways of, corroborating what information that you've collected from them, and so that does add time to any research project where you're trying to collect your own data.
Yeah, no, that's a really good point. I'm curious, Mark, what unanswered research questions regarding self-direction programs are the most interesting or kind of that next step in your mind?
Well, Holly, your comments sort of triggered a bunch of things. Certainly what we often hear about, what often comes up and stated is that these programs are more vulnerable for fraud. Whenever you're giving individuals control over their services or giving them control over a budget, in some people's minds, well, they're not going to be wise stewards of that control. And I think everybody who's on this call knows that that's not accurate. And so to really have a fraud, try and drill a little bit deeper into instances of fraud in these programs to kind of dispel that myth. I saw in the chat somebody asked, what is cash and counseling? So let me dovetail this fraud question with cash and counseling. The cash and counseling demonstration and evaluation was what ended up being a 3-state randomized control study. So each state, it was Arkansas, New Jersey, and Florida, needed to recruit 3,000 persons who were eligible for home and community-based services. In Arkansas and New Jersey, it was adult and elder populations, and then in Florida, they had to include children in their sample because they were having difficulties achieving the 3,000 mark. And so people of those 3,000, 1,500 were assigned to receive a cash budget and to manage their services so they could hire who they wanted to hire. They could purchase goods and services to meet their care needs. And then 1,500 were assigned into a traditional case-managed program. And the demonstration went on for, I think, 5 years all told. And researchers were able to, interview consumers as well as program folks, and to sort of see how people fared, people who were self-directing versus those that were in the case-managed programs. And it really is the sort of watershed moment for self-direction in the United States, particularly for elders. After the evidence that came in that people who self-directed had better health outcomes, they had better quality of life, there was less anxiety amongst their caregivers, and there was no significant difference in the fraud. You saw these programs enter into the mainstream of a little bit more, and they've only sort of grown more so over the last 2 decades. And so that's what cash and counseling is. In terms of additional sort of research topics, clearly there are things people want to know about these programs. Do they save money? That's a big question that often comes up. Things that I still find to be interesting, and I really would like to see if we could again drill down deeper in terms of who's using these programs, and are there differences by race, ethnicity, or gender? Because if we can see that they're maybe more popular in different groups, is that because they're more popular in those groups, or are we subconsciously excluding people who we don't think fit a particular profile for self-directed services? And then finally, the last thing that's sort of interesting to me is, again, looking at the impact of managed care and understanding from the participant or the person who's self-directing, their perspective of how things have things changed, have things gotten better, etc.
Very interesting. Well, gosh, I mean, I know we're coming close up on the hour here. I wish we all could sit around at the conference and have a glass of wine and continue our discussions. But any of the other teams, are there thoughts of what your burning questions are that you would be most interested in pursuing in regards to self-direction research outside of the projects that you're, of course, working on now?
Yeah, this is Joe. I'll echo some of Mark's. I'm real interested in the impact of MLTSS on self-direction. Is it expanded opportunities, or has it limited opportunities, or really had no impact? And then related to that, I think a line of research that we need to think about are you know, the quality measures that are used in MLTSS programs, you know, what quality measures do we want related to self-direction? You know, I think that's an area of future research. And then, you know, Mark has done like one of the only studies that I know about race, ethnicity, and, you know, preference for self-direction. And, you know, Sandy and I have been thinking a lot more about that and echo that that's a whole area I think we need more research on.
Yeah, absolutely. Well, with our last few minutes, I will turn it back over to Molly Morris to possibly ask any audience questions that came through during the discussion.
Yes, thank you, Holly. So we have time for just a couple questions. As Holly said, I wish we had hours and hours. But here's one that came in. Is there any research that measures consistent workforce and or choice of workforce and rate of pay? Do any of our researchers have knowledge on this? Maybe just for efficiency, I'll see Mark if you have any thoughts.
No, that's a very interesting question. I'm not aware of any work that's out there on that topic.
Are Brandeis team familiar with this, or anyone, Allison or Jennifer?
I think what they're asking about is the relationship between turnover, staff turnover, and rate of pay. That's what I think. I'm thinking that's what they mean by consistent workforce. Is that how other people are understanding the question? If that's how they're understanding the question, it's critically important, but it's a great example of the kind of information that you really can't get without extensive stakeholder collaboration, including, you know, that I think Holly referenced earlier. That's how I'm understanding the question. And I think it's a critically important question because turnover has such an important, you know, effect on, such an important driver of quality of care. So I think it's...
And it would be interesting to sort of, if you could identify people who are self-directing, who are paying, you know, above average wages in a particular state, and to sort of measure what's the rate of turnover in the traditional job market versus what's the rate of turnover for self-directed attendance.
Right. I mean, notably, though, that would vary by state in terms of like what and program, whether or not there's budget authority. But yeah, it's a great. I think it's a great. I think really interesting and important research question.
Yeah, you couldn't. You couldn't do it nationally, but because you're right. I mean, and these programs vary because most of them are funded by Medicaid. There's going to be that state variation in there, but it could be for an interesting. You know, you could sort of cast it around different labor markets around the country and just sort of come up with some sort of case, you know, study or descriptive study about it.
Well, we are close on time. I think if people are willing to answer one more question and go over a little, I'll note for folks that have to jump off, this is being recorded. But I do want to, since we got a couple questions about EVV, just really quick, and I know Jennifer has already addressed this somewhat, but I just want to give a chance for any of the research teams. We had a question of, you know, how did EVV impact self-directed care during COVID, and also, you know, curious if anyone's studied EVV. So if anyone on this panel has additional thoughts about studying EVV and its impact on COVID, would love to hear about that. Maybe I'll turn to the Brandeis team if you have anything specific. I'd imagine EVV probably came up in the conversations you had with folks across the country.
Yeah, this is Joe. I don't know how much that came up, you know, during our study. I don't know if Michael has any insights. You know, I think it's still something that's, you know, coming, and there are a lot of concerns, you know, among the disability community, and I think there's issues, you know, there in terms of like privacy and so forth that that we'd be interested in looking more as it gets implemented. But how the tie-in with self-direction, I think that's a whole other area that, and honestly, I don't know many people, if any, that are doing research, on EVV and self-direction.
Well, and I can add from an FMS standpoint, in multiple states, some of the states that we were in had already implemented EVV prior to COVID. Some ended up delaying implementation because of COVID, and some went on to implement during COVID. So we didn't see, I don't think, a huge impact in terms of states that were already implemented, and in some ways, EVV was able to be perhaps a safer method of timesheet submission than maybe going to fax your timesheet or something of that nature. But it's an interesting question, and I'm not aware of any research out there on it. So if anyone knows of any, I'd be curious to hear.
And this is Molly. I can say from Applied Self-Direction, we've not seen any research either, but we'd love to read it if anyone has done anything really looking at the impact. But with all that said, we are running out of time here. So I just want to thank everyone who's on this panel and Holly for moderating. Thank you all so much for having this conversation. And for those of you who joined us today, thank you for listening and being part of our conference and this session in particular. I hope that we will be having many more conversations in the future about how to continue to help self-direction research expand and grow and inform all the work we're doing. So thank you to everyone, and hope we'll see you at some of our future conference sessions. Take care.